Good afternoon, everyone. Today we're going to talk about tuberculosis. We're going to talk about what it is, its various treatments, and its symptoms. So we're going to start first of all with what is TB? Tuberculosis, also known as TB, is a disease caused by a type of bacteria called Mycobacterium tuberculosis. TB mainly infects the lungs, although it can also affect other organs. Various pulmonary TB symptoms are they can occur in the CNS, lungs, and skin, and can present themselves as appetite loss, fatigue, chest pain, coughing up blood, productive prolonged cough, night sweats, and pallor. Although the primary symptoms are fever, chills, and weight loss, which usually indicate pulmonary TB infection. TB is carried through the air in infectious droplets produced when the person infected coughs. There are various ways to detect TB. One of the first ones is a PPD test, where you do a skin test and a large blotch will appear if you become positive. It is a sub-Q injection, and the reaction reported is according to the diameter. The larger the diameter, the greater the positivity of the test is. Another test is the quantiferin blood test, which measures interferon gamma release assay in the blood, which indicates TB. And it can also be detected by sputum and x-ray exams. There are various different medications used to treat TB. We're going to go over 4 of them, which are used for active TB infection. First one being isoniazid. Isoniazid, also known as INH, suppresses bacterial growth by inhibiting synthesis of mycolic acid, which is a component of the mycobacterial cell wall. Important things to look out for when administering this medication is symptoms of epigastric distress, jaundice, which indicates liver injury, and peripheral neuritis, which is also an adverse effect. Liver function testing should be done prior to or monthly after starting INH. INH has also been known to cause B6 pyridoxine deficiency, so pyridoxine is needed as a complement to this treatment. An important thing to teach the patient is to teach the patient to take orally on an empty stomach 1 hour before or 2 hours after meals. Medication number 2, rifampin. Rifampin is used in conjunction with isoniazid as a complementary treatment for TB. Rifampin inhibits bacterial DNA-dependent RNA polymerase and suppresses RNA synthesis and consequently protein synthesis. Rifampin rarely causes significant toxicity, but you still need to do liver function testing prior to and monthly thereafter treatment. An important thing to teach is it can also decrease the levels of many other drugs due to increased metabolism of those drugs. So in sexually active women, it's important to educate them on the importance of other oral contraceptives. Adverse effects are hepatitis, and also a patient can present with a red-orange urine, sweat, saliva, and tears, which is a normal side effect of this medication. Medication number 3, ethambutol. Ethambutol is active only against mycobacteria and is considered a bacteriostatic medication, so it needs to be used in conjunction with either isoniazid or rifampin to be effective. An adverse effect of ethambutol is optic neuritis. Important note, obtain baseline visual acuity test and complete monthly after starting treatment. Stop treatment with ethambutol if ocular toxicity occurs. Last medication on the list, pyrazinamide. Pyrazinamide is a bactericidal medication used in combination with rifampin, isoniazid, and ethambutol. It is the preferred regimen for initial therapy. An adverse effect of this medication is liver injury, and it has been shown high-dose therapy has caused hepatitis and, in rare cases, hepatic necrosis. Assessing for a history of gout is important when using this medication, since polyarthralgias develop in 40% of patients. Liver enzymes are also needed at baseline and every 2 weeks during this treatment. And now on to patient teaching.
Patients need to remember to continue med therapy for a full duration of 6 to 12 months or up to 2 years. Failure to do so results in resistant strain of TB.
So you want to encourage your patient to do proper hand hygiene. You want them to also cover their nose when they're coughing and sneezing. And for active TB patients, wear a mask when in public. And last but not least, contaminated tissue should be disposed in a plastic bag.